So my dear friends, back with a new topic from first aid. Go to page number 357 and there you will find a topic called as carcinoid tumors. Carcinoid tumors arise from neuroendocrine cells. So what are these neuroendocrine cells? These are the cells that has got both neuronal as well as endocrine function, and these are located most commonly in the intestine or in the lung. Neuroendocrine cells, they secrete an enzyme called as 5-hydroxytryptamine. It's not an enzyme, it's a molecule called as 5-hydroxytryptamine, which undergoes the hepatic first pass metabolism होता है ना, and then there will be an enzymatic oxidation or a breakdown by monoamine oxidase enzyme in the lung. These are the two things that 5-hydroxytryptamine undergoes, and if this thing 5-hydroxytryptamine, it goes into the systemic circulation, then the patient will suffer. How will this 5-hydroxytryptamine go into the systemic circulation? This carcinoid tumor, when it metastasizes to the liver, this 5-hydroxytryptamine can spill into the systemic circulation, and if it does so, then the patient will have certain symptoms like episodic flushing, diarrhea, wheezing, right-sided valvular heart disease like tricuspid regurgitation and pulmonary stenosis, and symptoms of niacin deficiency. What do we get in niacin deficiency? It's called as pellagra. Pellagra mein what are the 4 D's of pellagra? Diarrhea, dementia, dermatitis and death. This you can note down in the side. Okay. And how do we identify this? What are the markers that we can go on as a laboratory testing to identify this is a carcinoid tumor? You can go for a urinary 5-hydroxyindole acetic acid. So 5-hydroxyindole acetic acid, this tryptamine will get finally degraded into 5-hydroxyindole acetic acid, which will be secreted in urine, and you can check for the levels of that will be increased. So if you go on for a biopsy and then go on for the histology, you can see a rosette like appearance of the cells. So that is the histology. That is what the histology is going to show, and to be more sure, you can apply immunohistochemical markers on the biopsy specimen. And what are those immunohistochemistry markers that we will get as positive in carcinoid tumor? They are chromogranin and synaptophysin. Okay, that will be positive for all neuroendocrine tumors, almost all of them. Okay, what is the treatment? Surgical resection, somatostatin analog can be given like octreotide, and tryptophan hydroxylase inhibitor like telotrisat. Telotrisat can be given for symptom control. Okay, so as a pulmonologist, if you would ask me what is the relevance of this carcinoid tumor for me, it most commonly for us it presents as a endobronchial mass, and we do a bronchoscopy and we will see this angry looking pulsatile endobronchial mask on bronchoscopy, and we will be afraid to touch because it looks as if it bleeds on touch, and it does. So what we do to be sure is we will go on for a gallium PET CT. It's called as a Dotanok PET. So usme if there is increased uptake, you can suspect that of course it could be a carcinoid tumor. And then the final approach is always resection. You go on through a flexible or most commonly a rigid bronchoscopy procedure. You go on for a rigid bronchoscopic intubation and then use a snare to cut on the pedicle of the carcinoid tumor and remove it. Okay, and there is a rule of thirds for this carcinoid tumor. 1/3 of the carcinoid tumors metastasize, 1/3 of them present with a second malignancy, and 1/3 of them are multiple. Okay, reading first aid is actually not very easy. We can read it together. Okay, now cut down on this topic. Yes, I have read it. करके tick mark कर लो. All the best.